Hi, this is probably going to be a long video, but what I really want to do, just in light of President Jimmy Carter passing away at 100 years old, can we talk about that? 100 years old. That is impressive. I am I'm covered in cat hair. I'm so sorry. You can't take me anywhere. Anyway, I just I feel like there's not a lot that's known about President Carter and what he did during his presidency. We know a lot about what he did post presidency. He was very prolific with his work with Habitat for Humanity, but like, what did he do during his actual presidency? Well, President Carter actually made one of the most, sorry, what would have been one of the most effective laws for mental health reform in US history. And it was just dismantled months, actually, I think a month after it was put into law. And I think in honor of him, I want to read something that I think is really, it's actually written by a student, which I find really remarkable. And it's just really clear and concise that talks about this law that Jimmy Carter put into effect, what it could have been, what it was supposed to have been, and how much we lost by it being repealed right away. So this is an article called the Mental Health Systems Act of 1980. It's written by a student or former student named Catherine Bell. This was in 2022. And I'm just going to read the whole thing because it really speaks for itself, but I'm going to insert my own commentary along the way because that's what I do. The Mental Health Systems Act, MHSA, of 1980 was intended to be a necessary safety net for those individuals who were unable to obtain mental health services without local facilities available to them. There was a strong groundwork in place for it to be effective, from the Public Health Service Act of 1944 to the Community Mental Health Act of 1963, as well as many champions within Congress and amongst the Kennedy family. However, the 1980 election brought in a change of power and a sitting president with a history of cutting funds for mental health services. The signing of the Omnibus Budget Reconciliation of 1981 quickly and efficiently reduced the capacity of the MHSA to provide services to those who needed them. And if you're a listener to my podcast, then you should recognize the name the Community Mental Health Act of 1963. I talk about it a lot on my show, and this article will get into that in a little bit. Prior to President Jimmy Carter, there were some prior forays into government-assisted mental health services. Notable acts included the Public Health Service Act of 1944, signed into law by President Franklin D. Roosevelt. It was created due to the growing realization of communicable diseases running virulent within the various branches of the armed services within World War II. It set out to establish rules for the government's ability to quarantine persons entering the country for the public good, called a Title 42 appointment, which is an accepted service employment category in the United States federal civil service, allowing for the hiring of special consultants as part of the public health service in a more streamlined manner. Another significant act, and this is the one that should sound familiar if you've listened to my podcast before. There's there's no pop quiz, but if there were, this would be it. Another significant act was the Community Mental Health Act of 1963, the last piece of legislation to be signed by President John F. Kennedy. The Community Mental Health Act planned to build 1,500 community-based mental health facilities, which allowed the population living in state-owned mental hospitals to be cut in half. Funding would be allotted to states based on population and need, and it would also allow for the training of teachers for, quote, mentally handicapped children. Only half of those 1,500 facilities were built, and many lacked adequate funding. Additionally, deinstitutionalization began whether the communities were ready for the mass release of people or not. Antipsychotics were beginning to become more available outside mental health institutions, including chlorpromazine, known commercially as Thorazine, in the 1950s. This only accelerated further into the 1960s with the advent of Medicaid to provide those in those in need of antipsychotics with the means to obtain them. After all, Congress barred Medicaid payments, quote, for people in institutions of mental diseases, but allowed payments for community mental health centers, end quote. So this is the time when mental institutions were starting to move toward deinstitutionalization. So this is a critical point when we need those intermediate facilities in place, especially as there are medications that are becoming available for so many people. Okay, I digress. Back to the article. Even before her husband's election to the presidency, First Lady Rosalynn Carter had long championed the mental health field. As far back as President Jimmy Carter's first term as governor of Georgia in 1970, she had made that field one of special interest to her, even volunteering at a hospital in Atlanta to learn more and joining her husband's Georgia Commission to improve the services available in the state, where the number of hospitalized patients fell by about 30%. She decided early on that this would continue to be her focus if her husband were to become president. Less than a month after President Carter took office, he issued an executive order creating the President's Commission on Mental Health, with Mrs. Carter serving as an honorary chairperson. The commission took over a year to study. Gonna read that again. The commission took over a year to study the healthcare needs of the nation before submitting their results in 1978, which would then be shaped into legislation shepherded through Congress by Senator Kennedy and by Congressman Henry Waxman into what slowly took shape into the Mental Health Systems Act in a few more years' time. The executive order itself was ambitious in scope, seeking to identify, quote, the various ways the president, the Congress, and the federal government may most efficiently support the treatment of the mentally ill, end quote. It sought to determine as nearly as possible what role the federal government could play in furthering the treatment of mental illness and how much it might cost. It wanted to know who is being served, who is underserved, and to what extent, and who is affected by this eventual piece of legislation. While the language within the document might have been mired in ableist terms of the 1970s, such as mentally retarded, the title of the commission itself was a departure from the past, with its focus on mental health rather than mental illness. The commission, which led to the Community Mental Health Act, after all, had been the Joint Commission on Mental Illness and Health, which ran from 1955 to 1961. The creation of the President's Commission on Mental Health was only the first step toward the eventual bill that would become the Mental Health Systems Act. An early stumbling block was the role of Mrs. Carter. She would have preferred a more hands-on position as she had taken in Georgia as the chairman of the commission. However, on a national level, there were some questions as to the legality of the First Lady being in this role. This was sidestepped by having Dr. Thomas E. Bryant, president of the Drug Abuse Council, serve as chairman and make Mrs. Carter the honorary chairman. More than 1,000 names were submitted for the 20 committee spots. The commission itself was selected with diversity in mind and with the aim of having a committee that was not solely staffed with psychiatrists. Instead, it would contain academics of varying fields, a labor leader, a minister, several lawyers, human rights and mental health activists, and a few psychologists. One member, Priscilla Allen, was a former patient who insisted on an integrated system linking psychiatrists with community services and discussed the more practical side of matters, such as bringing reality theory to reality. So I'm going to pause here because it goes on, but I'm running out of time. So this is part 1 of 2, at least 2.